Hello there, welcome to the final episodes in the month of May when we're talking about various forms of scrotal abnormality that may or may not result in sexual dysfunction. And this week we're going to talk about accumulation of fluid inside the testicle. Exactly how does fluid get into the testicle? In fact, there are two ways. One form is called hydrocele. Imagine that the testicle is surrounded by fluid that allows it to move, and sometimes that fluid itself can get accumulated actually from fluid directly from the abdomen, or sometimes it can be secondary hydrocele that is caused by infection or cancer of the testicle. The fluid itself can cause enlargement. On the other hand, there may be another fluid accumulation caused by something called epididymal cyst. In fact, nobody knows why epididymal cysts occur, but it's very common, up to 10 to 20% of general population. Epididymal cyst itself can accumulate around epididymis and can get quite big, and it's difficult to differentiate between epididymal cyst and hydrocele. So does that cause sexual dysfunction? Well, unless it becomes so big that it is so uncomfortable, yes, it might, but overall it doesn't associate with sexual dysfunction. And the operation itself is a simple operation. What we actually will correct the actual hydrocele, or on the other hand, excise the epididymal cyst to make the testicle less dragging and less heavy, and for the patient to be less uncomfortable when they have sexual intercourse. So indirectly, the accumulation of fluid itself might create anxiety and makes men worried about sexual activity, but directly it is not associated with sexual dysfunction. And the relief of that fluid actually most of the time makes men a little bit happier and less dragging effect in the scrotum, causing problems during intercourse. For the month of June, we're going to devote the whole month to pediatric problems. And the first week, we're going to talk about undescended testicle. If your child suffers from undescended testicle, or you worry you yourself as an adult might actually have one testicle that's hiding away, then you stay tuned for next week's Putting Dr. G on the Spot.